If you're out there, whether you have little kids or don't, or just have a very busy, hectic life, or just not enough time, and time is always the thing. I don't have time to exercise. I don't have time. If you can find 20 minutes per day or 20 minutes a few times a week to use BFR, you're going to get some amazing results. You can get a lot of results in a short period of time. So my husband and I use BFR all the time for our own musculoskeletal health, plus our cardiovascular health. I'll go down here on the treadmill for 15 minutes, putting BFR on my legs and getting both musculoskeletal and cardiovascular system moving. He uses it a lot for 15 minutes. He does it a lot more so for muscle building and hypertrophy and strength gains and things like that. But we don't have an hour every day to do a full lift.
Well, it's a real pleasure to have Susie Lachowski-Glass on the show. Welcome.
Welcome. Oh, thank you, Zara. I appreciate you having me today.
Yeah, I'm excited about this conversation. I've been waiting for it for a long time. And we're going to talk about blood flow restriction. And anybody who's been following me more than a minute know that I've been talking about BFR and targeted compression training, like all these words and these bands that I'm wearing. And it's still so new for so many people. And I'm learning. I don't know as much as you, and so I want you on here to explain a little bit what is this concept of blood flow restriction training, and then how does this differ from traditional resistance training? Because people know not everybody knows what resistance training is, but we should explain what resistance training is as well, just in case.
Yeah, sure. No problem. So I guess I'll start with the traditional resistance training. So traditionally, resistance training is you want to do a progressive resistance overload, meaning you're starting to lift heavier and heavier weights to get some sort of muscular adaptations to increase strength and muscle size and so forth. That's the basic premise behind resistance training, is lifting weights or performing some sort of body weight exercises, things like that, to get XYZ adaptations like increased strength, again, size of muscles, which means like hypertrophy and things like that, which aids in overall like balance, longevity, quality of life, and things like that. So that's traditionally, and resistance training has been researched for, it seems like, thousands of years for the most part, on how it helps overall health with regards to musculoskeletal system, your bone tissue, other types of things going on like collagen production, stuff like that. So when we talk about blood flow restriction training, is what BFR is, it's a specialized type of training where you're going to put a band or a cuff proximally on your limb. When I mean proximal, I mean like as high up as you can go on your, say, your upper extremities, and then on your lower extremities, like your leg. So when you place like a band or a cuff kind of right below the shoulder muscle here, what we're going to do is alter blood flow patterns to and from the muscles, right? So by altering, we're going to add in various pressures to these systems in order to manipulate blood flow patterns. We're also going to exercise at low loads and low intensities. And when I mean low loads and low intensities, I'm talking about almost like body weight exercises, really low weights, like 1, 2, 3, 4, 5 pound weights that you're using, a lot of the times just body weight. And when I talk about percent rep max, when I talk about you're looking at maybe exercising at 20 to 30% of your 1 rep max. And for those who don't know what 1 rep max is, when I reference that, is all it means is a 1 repetition maximum is the maximum amount of weight you could actually lift or push up. If you're doing a bench press, say, you could push up for only 1 repetition. So let's say that's you could lift 100 pounds. That would be considered your 1 rep max, but you couldn't get to a second rep. Okay, it would be too heavy at that point. So when I'm talking about low loads at 20 to 30% of that, you would be referencing exercising at 20 to 30 pounds. So very low weights, low stress on like the joints and the tissues. But by using blood flow restriction, or we're altering these blood flow patterns while lifting at low loads, we're seeing all these physiological adaptations that occur as if you were lifting very heavy weights. So we're starting to see, it's been researched for decades on like increased muscular size, increased muscular strength. We see increased or decreased resting heart rate, decreased resting blood pressure. We see improved functional capacity, enhanced recruitment of those muscle fibers, all by using low weights, but just by manipulating blood flow patterns. And I can dive a little bit more into the science. You might be thinking, well, how does that work? How are we emulating, just by manipulating blood flow patterns, how are we getting all of these very similar results to heavy resistance training as we are, but by lifting low loads and manipulating blood flow patterns? And if you want me to dive a little bit into the science, I'm more than happy to do that for you, Zora.
Okay. So what I'm going to do is get our editor to put in some videos or photos of what this looks like, because actually we should have had our own bands to kind of show,
Yeah.
but we'll do a little video. But I'm glad you mentioned the word manipulating blood flow patterns, because it sounds less scary to blood flow restriction. Like people say that those words are scary and that's probably a bad thing, and people are imagining you're completely occluding or cutting off that blood flow, which would be bad unless you needed a tourniquet to stop blood flow because I don't know, your arm fell off or something. But what I want people to understand is that we're changing the pattern of the blood flow in order to get these adaptations. And what I heard you say, which I repeat all the time, is that we're able to lift with lighter loads but still getting the benefits as if we were lifting a heavier load. And as a gerontologist, I was, when I was studying in my master's program, I was wondering, why aren't we talking about blood flow restriction? This sounds like an amazing protocol for an older adult who just got surgery or is injured or just won't go to the gym. So I can't ask my 89-year-old father-in-law to start lifting weight. He just won't do it. But maybe he could bond on some bands. And so I would like for you to, I don't want to say dispel the myth, because maybe there are contraindications, I guess, of people who could do blood flow restriction and who couldn't. And I know that there are many devices out there and maybe some are safer than others. So talk a little bit about the problem with somebody saying this could be very dangerous. Is that true?
No, absolutely. And I'm glad you mentioned the kind of the challenge of the terminology of blood flow restriction training. I've been using and researching and practicing with this modality for over a decade now, for over 10 years. And I'm still fighting when I talk to individuals, blood flow restrict, like having the word blood and restrict in the same sentence, sometimes to someone who's not understanding, be like, oh, that sounds a little scary. And what are you going to do to my blood? That can't be good. Is that going to hurt? And it gets kind of almost this like fear occurs. So I always joke that I'm going to make this little TM at some point, that if I were to have made the name of this modality, I would have probably called it something like hemodynamic alteration training. And if someone was like, hey, what does that mean? And if I would be like, oh, hemodynamic just means blood flow patterns, and all we're going to do is manipulate blood flow patterns to get all these great benefits, I feel like there'd be a way better buy-in than blood and restrict. That's just my little side note for you and your listeners.
We'll call it.
So yes, you want me to talk about, again, so is it safe and effective? Yes.
Yeah.
So, I mean,
what do you say to somebody who says, okay, that sounds dangerous?
Yeah, luckily this modality actually originated, and it sounds still very new, but just to give a little history of it, this manipulating blood flow patterns idea has actually been around for decades. And it originally started in Japan by a man named Dr. Sato, who figured out about this whole manipulating blood flow patterns to get all these physiological effects. He was a bodybuilder, came from a family of physicians, and he was actually in a funeral, and I believe it's called a CISA or CISA position. And he stood up and he felt like he had just performed an explosive workout. And he's like, oh, I must have been maybe altering blood flow patterns somehow to get my legs to feel this exhaustion. Long story short, that's what kind of spurred him to do all this research over decades. And it's actually originally called KAATSU training. So KAATSU meaning additional pressure in Japanese. So where then that's been researched for decades with all these biochemical markers, musculoskeletal markers, cardiovascular markers, where they are researching how to manipulate these blood flow patterns safely and effectively, so to what you just said, that we're not cutting off blood supply for long periods of time. Because as you know, when you go into surgery, and people are still very safe, you get a total knee or a total hip or something, your blood supply to that limb is cut off for hours on end. And even though you have a slight increased risk for, say, like a clot or an event post-surgery, it's still overall fairly safe. So when we're talking about blood flow restriction, we're not even cutting off your complete arterial inflow at all. We want some arterial inflow and manipulating maybe what's called venous outflow, so the exiting of blood from the tissues back to the heart. So there are some great research studies out there that kind of have a meta-analyses of the safety of blood flow restriction training and KAATSU training, and it's very low risk for any sort of adverse event, such as, say, like cardiovascular event or a DVT or injury or anything. And I do want to put like a caveat on there, doing it safely and effectively. You can hurt yourself by just, say, tourniqueting yourself off and going to go to the gym and trying to get a pump in and things like that. And we'll probably get to that point in this conversation. I'm sure you have questions for me there, but there are ways to go about this modality safely and effectively with no adverse effects at all. Again, to your point, we'll get to kind of how I got into the modality, but it's one of these things where I like to tell practitioners like my PTs, athletic trainers, personal trainers, strength coaches, anyone who wants to use this to their clients or patients or just for themselves, that it's really just good to be educated on overall kind of what BFR is and using a safe and reputable device to get reproducible results.
Okay, so this is a great point. I've heard is that yes, it's been around for a long time. There's a lot of research done on it and all kinds of types of bands as well. But when I first learned about blood flow restriction, where I heard it, it was a friend of mine who told me, and then I think I heard it on Ben Greenfield, and then I reached out to a guy named Dr. Chris Gaviglio, and he's an exercise physiologist, and he has a whole podcast just on BFR. I didn't know you could do a BFR podcast, and that's I think the name of the podcast. And so I just learned so much from him, and he was breaking down the science. Every time there was a research study, he would go and break it down in words that we can all understand. And so as I was researching too, I would Google blood flow restriction, and I found on YouTube two camps. There were the gym bros who were trying to get a little bit more gains with less weight. And then there were the physios, the therapists, the people working with injured people post-surgery. And that's very interesting because it seemed like you could use them for many different types of things. So you are a physiologist, right? And so how did you get introduced to blood flow restriction and how are you using it in your clinic?
Yep. Nope, absolutely. So I actually, when I was in graduate school about a decade ago, trying to figure out what I wanted to do for my dissertation and things like that, what ends up happening was I came across and read a KAATSU physiology article. It was purely on the low load, low intensity, and they saw all these physiological effects at lifting at 20% of their 1RM, doing barely any weight, but seeing all these increase in muscular strength and neuromuscular recruitment and all this growth hormone response. And I tell you, sorry, I had to like read it 2 or 3 times. I'm like, there's no way. It's like I was an athlete all growing up. I played soccer, basketball, tennis, all these kind of things. I'm always around like fitness and stuff. I'm like, and I had to read it like 3 times. I'm like, how are they getting these results? But it didn't really add up to me. But then once I understood and dove into what's actually happening at the physiological level, like right at the level of with what's going on with the heart, what's going on with locally and systemically. I'm like, wow, like to your epiphany point, I was like, why isn't anyone doing this? I like looked around, like, why isn't anyone understanding this? So I remember I went right to my chair and I said, I want to do a BFR study here. I said, that's my dissertation. I want to do a BFR study. And I think this would be great. I had to convince my committee, IRB, all these other kind of things that this is going to be safe and effective and all that. And so I was like the first study that brought it to my college there. So I ended up doing a BFR study. I ended up going to the library, got as much as interlibrary loan as much as I could with all of the whatever research articles that were out there, had them translated into English if they needed to be. And I was like, you know what? I just immersed myself in this whole modality. And I said, this sounds, to your point again, that I'm like, wow, this could have great implications for post-surgical rehab. I was like, my own fitness, my own health and well-being, and my parents, to my grandparents, to Gen Pop. And again, I'm like looking all around, like, wait a minute, we got to get this word out here. We got to get this information out here. And so that's what spurred it a little bit. And then from that dissertation, I presented a few conferences, and then I started getting calls to come educate different. I've educated the orthopedic surgeons in Boston at orthopedic. So one of the head surgeons wanted his surgeons to put it in prescriptions for PTs and things like that. And then I got called all over the place, which kind of then helped me create comprehensive education for practitioners, as well as I help train individuals and so forth. But a big piece is the education piece on my side. That's what got me going. And then it just took off from there. I still work. My main position is I'm at the college. I'm an executive director and professor of our health and human performance division, and I teach in our physical therapy division as well. So I'm a professor and an educator by trade, I guess, so to speak, but I also still train clients in the modality and teach other clinicians on how to bring it to their patients, and just trying to do my part in spreading the good news about this modality, that's for sure.
Okay, that's a great overview. And it's funny to see how we all fall into this and look around and going, why isn't anybody else talking about this? It sounds like a miracle. And but when I got my first set, the first set I had were like an Amazon, just a tourniquet. And then I got scared. I'm like, I don't know what I'm doing with this. And like I gave up. Then I heard Chris's podcast and he had a pair that had this pump. It looks like a blood pressure cuff and you pump it. And he told me how much to pump and how much pressure and all this stuff and weighed and measured. And I was like, okay, at least I feel safe. Now there's a guy like watching me. And I started using this and I would measure my muscle mass and through a body composition scale and also measured with a med tape. And I said, actually, I'm gaining muscle and it's working for me. But I wasn't sure. I was like, is this just me? Am I an anomaly? I don't know. So I started talking about it through my social media and some people bought that same band and they would report to me. They're like, yeah, actually it's working for me too. And so I said, okay, it's great. It's not just me. Then I've advanced to it was the KAATSU bands. That came to me at a point when I had osteoarthritis. And I was so happy to get these bands because they're quite easy to use. I had the tube model because this one it automatically inflates with air and then this deflating. And we're going to talk about the different types out there. But then that really changed my life because I was worried over the course of a year and a half, I was exercising less and less and less. The doctor said no impact, no high intensity, just your rehab. And I got to the point where I couldn't walk more than a few steps. It was so bad I had to have the 2 hip replacement surgeries. So you can imagine the slow decline got worse and worse. And I just kept using these bands every day. I never gave up. I kept asking, is it safe is it okay to use these every day? Because I don't know what else I'm going to do. And I saved my muscle mass and I not only saved it, but I also increased it. So I was so surprised. And over the course of that year or so, other people were watching my story and then they would go buy these bands and then they would have results. And then I really got confident. And I was like, okay, all these different kinds of bands seem to be working and will get us the same place. We're all seeing results. But perhaps the people who don't actually, whoever ever got in touch with me, they said, well, I haven't been using them. I'm like, well, they don't work if you don't use them. The only negative feedback I got, because if people buy these bands, they're not cheap. So I think they're pretty heavily invested in using them most of the time. But so now I'm really convinced that this is just me and my small circle of people I influence and who get back to me. But you've also worked with people who have needed this and you're probably seeing them eye to eye. What are you seeing in terms of results? And me personally, I don't really know these people who get in touch with me. They just say, yes, I've seen an increase or I feel good. But you're dealing with people probably who are injured or who are really seeing them a bit more closely than I am. So I'd love to hear your feedback on what's working for people, what's not working for people. And are you seeing these kind of results as well?
Yeah, no, absolutely. To what we had said before, the versatility of the modality, I have worked with post-surgical. So I work in conjunction with physical therapists. Or my athletes at the school. Sometimes I help them down with athletic trainers and things like that, getting them started. So I'll work with post-surgical athletes or just anyone who's post-surgery in general. I've had an individual had 2 total knees actually, and could talk about him a little bit. And I even train right now the aging population with it. And there's no really other adverse effects other than there's some osteopenia present and just decreased muscle mass, decreased endurance, things like that, and trying to pick that back up. So kind of a wide variety. And then the other camp that I've helped use it in is just my higher level athletes that aren't injured anything. And like, how could you program BFR into just help augment what they're doing already in the gym? So again, there's so many ways we can kind of place this modality that could actually help either with recovery, just performance in general, or health and wellness and increase your quality of life. So I guess I'll talk about a couple different things here, but like post-surgical, it's great in the sense of, as you know, let's just say talk about a knee surgery or a knee injury. A lot of time you can't load your tissues heavily, as you just said, right? And sometimes we can't even manipulate the joint past a certain angle because you can't compromise the surgical site or the integrity of the tissue. So what we tend to see is massive amounts of sarcopenia or atrophy, and ultimately that just means like muscle wasting. So when we see the muscle getting smaller, what also comes along with getting the muscle smaller is decrease in strength, decrease in muscular endurance, which then plays all into your quality of life or your performance on the field, and like all these other like things kind of snowball. So what's really neat with BFR is that you can right away post-surgical, as long as there's no other like crazy absolute contraindications for the individual, we can start BFR fairly soon after surgery as well as post-injury. And I'm going to use an example. Let's just say someone can't bend their knee or load their knee past low loads. You're like, well, you can't because you could increase your risk for further injury. But then you're like, okay, now I'm risking all my quads going away and things like that. So what could we do? So sometimes just by manipulating these blood flow patterns to the muscles, all these, like I said, great physiological things happen. We can preserve muscle mass. We can preserve breaking down of the tissue. Now, might there be some? Yes, there might be some, because again, if you're not walking, you're not using it, and definitely, but we can preserve a lot more than we normally would lose as if we were just to be sedentary for the most part. So what actually happens is, and then the other piece too is we've added an extra like TENS unit or e-stim. And those of you who don't know what that is, that's really where you can kind of place those like electrode pads on your leg and involuntarily contract your muscles. So you're like the machine involuntarily contracts while you're manipulating blood flow patterns, but you're not compromising joint angle or the surgical site at all. So what that really does is it helps induce that metabolic overload, the cell swelling, all of that, which can help preserve muscle mass. So that's a great way to help preserve muscle tissue and strength post-surgery or post-injury. Let's go to the opposite side. I have aging individuals. I have probably about a couple that have osteopenia, maybe and heading into a little bit more of a minus T score, but they are trying to catch it, so they're not going too far down the osteoporotic hole there. I really feel weaker. I'm nervous about my balance as I'm getting older. I don't want to risk falls. I want to be able to play with my grandkids. That's like number one. I want to be able to roll on the floor with my grandkids and play. Like I feel like weak. I feel I'm not as strong as I used to be. But then a lot of the times, again, a lot of these individuals don't want to get under a heavy squat bar. They don't want to do heavy resistance training. Some people don't have the time to have an hour and a half training session per day. Time is going to play a huge factor. And also the last piece is some people don't have access to that equipment. Well, I'm not going to go get a full gym membership and do all this I just want to do exercise at home, but I want to build muscle mass. And this is a great way to do that. Really, ultimately, you just need some of these bands, and you can get a lot of these responses, these great responses, just by doing body weight exercises or really small weights, walking, even those like basic exercise bands. You can do a ton of band workout with them. So really, ultimately, you need is just a really good BFR system, and you can get all these adaptations. And we can use it with our traditional athletes. We have used it with traditional athletes a lot of the times during recovery. So say they had a very heavy lift on a Monday and they get that a little bit muscle soreness. You're not going to heavy lift again on Tuesday. But how could BFR maybe augment that recovery process? We'll do some light BFR, light cycling, light work to actually help get that nice big like flush and that neurohormonal response going to potentially help heal and augment what they're doing there. So we fold it into kind of whatever the athlete or the population needs it as they do that. So there's a ton of implications for it.
Okay, great. I'm glad you're actually seeing these similar results too. Like you see people progressing and doing pretty well. You're obviously trained in this. So it could be also different than somebody's like, oh, I'm just going to buy some of these things online and then not really know how to use them. So hopefully they'll get some and have good guidance or work with a physiotherapist who can guide them through it. But I'd like to explain a little bit, because when I was post-surgery, I would put the band on the opposite leg that was not operated on within a few days. Because I thought, well, you don't want to put it on the injured site. So I said, why not? I still can get blood flow. I can still get growth hormone. And maybe you can explain a little bit, because as post-surgery, or you're looking for growth hormone, you need to repair things. And so explain, how does BFR release your own endogenous growth hormone?
With BFR, you're getting local and systemic effects. And what you're talking about is a systemic effect, which we'll get to. So let's just say we have BFR on one of our extremities here. Some of the local effects are going to induce some cell swelling and like that metabolic overload because we're diminishing the return of waste. Just for reference to anyone listening would be when you lift or you feel that muscle burn, it's like, wow, I got a really good workout. Oh, I got to drop the weight. So that's kind of what it's going to feel like is a nice muscle burn, but not painful, but you're getting a good workout. Just because that's that metabolic waste building up and you're dropping your pH in the muscles and within the blood surrounding. So that's why you feel that muscle burn and you're inducing some cell swelling. But with that metabolic process, what's happening locally, that you're going to produce things such as like lactate and hydrogen, and that's metabolic waste that's building up in the muscle that is working. And since we're restricting venous outflow, so meaning like the blood flow leaving the limb, and that's the point of these systems, are to restrict the outflow of these metabolic waste. What ends up happening is, excuse me, like lactate and hydrogen from a metabolic standpoint press up on our mechanoreceptors within the muscle belly. And what ends up happening is that those mechanoreceptors send a signal up to the brain that says, hey, we're under heavy amounts of metabolic stress here. We need help. So it sends that signal to the brain, tells us that we're under a lot amount of stress down here. We need backup. So what ends up happening is the hypothalamus talks to the anterior pituitary gland and we release this whole surge of growth hormone. Okay. So when we release this surge of growth hormone from the anterior pituitary gland, that goes everywhere in the body. So that's what we mean by when we talk about like these systemic benefits, meaning the growth hormone is going everywhere. When you have that surge of growth hormone, hours later, it will help release what's called IGF-1, and a lot of IGF-1 is stored within the liver. So hand in hand, IGF-1 and growth hormone can help build and repair tissues, but not just where the muscle's working. So say it was my right arm that was working, it's going, to your point, is everywhere. It's going systemically. So when you put it on the opposite leg, even though your left leg may have been working, inducing all that metabolic stress and cell swelling, what you did was send a signal up to your brain, which then released that growth hormone. That growth hormone goes everywhere in your body and can go to your right leg to start helping heal the right side. So that's where I try to teach physical therapists and athletic trainers this, that a lot of the time the protocols are like, oh, we can't put BFR on the affected limb, meaning the injured limb or the surgical limb, till 6 weeks post-surgery or 8 weeks post-surgery. So then BFR is kind of lagged for about almost 2 months, where we could actually be using it on their arms or the opposite leg to get this whole systemic response to help augment the healing process. So to your point of like post-surgical, think about it with wound healing as well. So think about things that even you're not going to place a band where maybe an open gash is and you just had it sewn up. You're not going to put pressure to press on the stitches or anything. However, if the other limbs are okay, why not get that bigger systemic response going? And those of you who don't know what growth hormone IGF-1 is, these are anabolic hormones that help build and repair tissue. So it helps build muscle tissue, bone tissue, as well as like collagen and things like that. It helps build, repair, and heal. So these are our two big hormones that will help us do that. And BFR is a great way to get growth hormone and IGF-1 surging systemically.
This is really interesting. So growth hormone, I first heard about this was when years ago, I guess it was trendy to inject growth hormone. And I was like,
Yeah.
that sounds dangerous. I don't know about that. But when I found out that BFR could actually help us release our own growth hormone, I was like, this sounds okay. This sounds much better to me.
Yeah.
And a little bit safer. But I'm wondering, the way you explained it is when you're partially restricting the blood flow, we're getting a signal to the brain. The brain is going to say, hey, we need to repair, pull out the troops here, release the growth hormone. Does that not happen just when you exercise in general?
It does. With high intensity exercise, it does as well. Yep. So
Okay.
again, so when you're under the high amounts of metabolic stress, so that's where BFR and like high intensity resistance training have a lot of similar physiological mechanisms for that release of growth hormone. So if I were to lift heavy weights, as long as I get to almost what's called failure, so say that last rep where I'm like, oop, that's my last rep, and you're down, and you feel that metabolic burn, yet again, you can get that with BFR, but you can also get that with heavy resistance training. So that same response is going to happen. We're going to induce that cell swelling where we're pulling blood to the working tissues. We're going to induce cell swelling, which can help increase protein synthesis. as well as that metabolic overload is going to happen just like that same cascade, sends the signal to the brain, says, hey, we need some help, surge of growth hormone. But this is where heavy resistance training and BFR can do very similar things just by low loads, manipulating blood flow patterns, or high level weights.
Great. So this is where we want to explain that if you cannot or do not or will not lift something very heavy, which can be dangerous if you don't have anybody watching you or spotting you,
Correct.
this is a really great alternative. And if you assuming everything's fine, we're not talking about people for injured or maybe if you are injured or surgery, but we're just saying even if you are just want to get a little bit of extra gains, but you just will not lift the heavy weight for whatever reason. Now, I wonder how much it actually compares to lifting heavy weight. Is it one to one in the sense that if you can lift 100 pounds and then you decide to go at 20 and do with a BFR, are we going to get exactly the same amount of gains, or is it just so variable it's hard to even measure?
So that's an area of research that we're trying to look at a little bit more to see the benefits here. So typically what still seems to shine through the most is the heavy resistance training when done properly. So this is going to get to our other point of some people don't know how to lift properly mechanics. Like sometimes doing like a deadlift, someone will be like, I don't even know what you're talking about when you say a deadlift. What does that mean? You know what I'm saying? Or a bench press. To get to that point where you need to make those muscular adaptations, you need to be able to lift some heavy weight. But then if you compromise form or your biomechanics, you could then increase your risk for injury. And when you do, that's that slippery slope. So this is where BFR is a great, what I like to call tool in your toolbox to be able to use to recruit all these muscle fibers as if you were lifting heavy weights. So it still seems to be like, for example, there's a lot of great bone density markers with BFR starting to come out in the research that it may help augment these bone markers to help lay down more bone tissue. But high resistance training, due to that stress that's placed on the bone tissue, has been definitely well researched and known to be able to like place that stress on the bone tissue. That's going to signal the bone tissue to lay down more bone to make it stronger. So that's why typically we look at to do the high resistance training there. So my other caveat to BFR is I always like to tell practitioners or even anyone using it, it's definitely a tool to have in your toolbox. I'm not trying to say, hey, BFR should just go replace everything you absolutely do and that's completely it. But I do feel everyone should have this tool to use in their toolbox to help augment all these other things we're starting to talk about with muscle building, recovery. And the other benefit is that it's also a cardiovascular modality as well, which a lot of people don't know about.
Yeah, I want to go into that too, because the results that we see and feel right away is even a pump, even from the first time you put that on, even if it's just 5 minutes, you go, oh, wow, you see the pump. Okay, that subsides. But over time, if you continue to do this, then you can actually build muscle that lasts. But so we understand the hypertrophy. We understand gaining more strength. Now, the other physiological changes in the body that we don't see, this is interesting. I want to talk about the cardiovascular benefits of it. What's the research showing and the benefits that are there for our heart?
Yeah, absolutely. So and again, comparing it to say potentially heavy resistance training, as we know, heavy resistance training, meaning like lifting really heavy weights, does great for the musculoskeletal system, but does little for our cardiovascular changes, right? We would need to do some aerobic fitness and aerobic type of activity to get those adaptations. So the great news with BFR is you almost kind of hitting, I like to call two birds with one stone almost, in the sense that BFR is actually in the literature being shown to help decrease resting blood pressure, help decrease resting heart rate, and increase blood flow to various tissues. So I'm going to explain a little bit about how that goes. With BFR, what's actually happening is we're releasing something called locally to the muscles that are working, what's called VEGF. It's called vascular endothelial growth factor. And what that does is it helps produce new capillaries. So when we produce new capillaries, that means we have enhanced blood flow to be able to bring nutrients to the muscles as well as take waste away. So we're becoming more efficient in that aspect. And that's going to play a role in our cardiovascular efficiency with something that's called VO2, which is called like our aerobic capacity. So that's one benefit, is that we're producing more capillaries, which enhances blood flow to the tissues, to the skin, and to other places in the body. Another way it increases blood flow is when we increase the amount of, so let's just say we release the bands and you have this like surge of that you feel like this surge of blood flow coming to the area to induce all that like cell swelling and distension and so forth. What we're doing is we're putting stress on the vessel walls because of that surge of blood that's coming through. When we put that amount of stress on the vessel walls, we have a vasoactive substance that's actually lays in our vessel walls. It's called nitric oxide. And when we place that stress on the wall from that increase in blood flow, nitric oxide is released. And when nitric oxide is released, it actually dilates the blood vessels immediately. So we actually can go from a blood vessel that's normal size to actually wider. So when we have a wider blood vessel, now what does that do? That enhances blood flow to the area as well. Blood flow to the area and bringing it back to the heart. So now we have a more of efficiency of not only bringing blood flow to the area, but also coming back to the heart. Now, speaking from a central standpoint, which is a heart mechanic standpoint, when you're doing BFR, what I'd like everyone to know, if you decided to start or going through this, your heart rate is going to go up fairly quickly, probably a little bit faster than you normally would assume, just due to thinking about it. When you're manipulating blood flow patterns, we're restricting venous outflow, so meaning blood flow out of the muscles and meaning back to the heart. So when we're kind of diminishing blood flow back to the heart, is going to have to pump faster to keep trying to maintain what's called cardiac output, right? So if we're reducing venous return, then we have to increase heart rate in order to keep exercising, to deliver blood and nutrients to the working tissues. So that's something you will see fairly quickly. But as we know with cardiovascular training, we need to get our heart rate up to help decrease resting blood pressure and resting heart rate. So this is another way blood flow restriction actually does that. Even if you're lifting or doing some body squats or things like that, you can actually, by having your heart work a little bit harder, you can actually see a lot of these other cardiovascular benefits as well.
And you can feel them. Actually, I remember when I first started, I would have a heart rate monitor and I would watch my heart rate increase just doing some squats. Or if I was lifting a baby weight, like I was at home and I didn't have a gym, I just lift this weight and I was like, God, this feels like I'm lifting a truck. It's harder, but you also can see on my monitor that when I released the bands and then I did the squat, then my heart rate came down. So it is interesting to play around these markers, and you can see right away. And evidently over time, this is bringing more strength to the heart and it's making you more resilient, which is incredible. And then if you have more blood flow, this is really good for your brain. It's good for your skin. It's good for so many other things that we don't even think about, because when we talk BFR, we're always like muscle, but there's so many other great benefits. And there is one question that I had from one of the women in my community. She was wondering, she started using her BFR like half an hour before bed and on a recovery mode, not exercising, just as she was reading a book or on a computer. And then she said, the days that I'm wearing them, I'm having really good sleep. Is there any research supporting that? Or am I just making this up? Because it was only a few times, she couldn't really conclude. But do you know if that would help with sleep at all?
So I don't have a study I'm going to pull out and just say, this is how it's affecting this, things like melatonin. I don't know. You know what I'm saying? And I'm not saying that it's not out there. However, one can conclude, just thinking about the physiology of it, if you're really kind of engorging our vessels and we're improving blood flow, we're increasing all of that, we're increasing like kind of growth hormone and all these. You also are releasing endorphins, which you're not realized, like your feel good hormones and your monoamines and things like that's occurring from that brain standpoint, which typically tends to relax you a bit more. So I think I'm just going to make my own conclusion here. I could assume that based off of all these other benefits with increased cerebral blood flow, right? It helps increase cerebral blood flow. So cerebral blood flow, you release growth hormone, all these other neurotropic factors that helps, your mood, your anxiety, all those kind of things. One could assume that I would have a better sleep, but that's just my own deduction if you could kind of see it out there that way.
Possibly. Let's do some experimentation. I told her I would start doing that just to have my own N of one experiment to see if it's true. But let's go on to the devices out there, because there's so many. If anybody starts to search, where do I buy one? And they all ask me, which one should I buy? It's like, I need to make a PDF. I have to make a PDF on this. And if I do have it, I will put it in the show notes right away. So can you explain the different types out there and what someone should look out for when deciding which system is best for their goals?
Sure, absolutely. So speaking of that PDF, I'm happy to share you the one I made. So you can more than welcome to share it.
Oh yeah, that's right. You do have one.
This is a different PDF. It's just a pure device one, just to kind
Oh,
of help
okay.
people, like if they listen to this podcast or are reading it, like it just helps break down the categories I'm actually about to talk about.
Perfect.
So
Send me that. I'll put it in the show notes.
you got it. So a big part of my education with this is that where I saw a big gap 10 years ago when I started talking about BFR and the benefits and all these things, I'm like, all right, there's a lot of questions on here. And then as new devices pop up on the market, so people are like, what about this one? And then if you're a device company, you're like, I need to sell my device, that you're a business. It makes complete sense. However, as a practitioner, I kept getting a lot of requests on this very question that was like, well, what's this? I'm like, there needs to be some sort of comprehensive education piece that then you can make your best decision on what you think is best for you. But let's just lay it out there from this practical standpoint without having any like marketing in your face kind of thing. So a big piece that I talk to, because I get a lot of questions like this from athletic trainers, physical therapists, personal trainers who are going to use it in their own practice on clients. They're like, what one should I use? Or which one should I use? Or what do you think might be best for my practice? How I like to break down BFR devices into three main categories. The three main categories I like to call one is non-pneumatic, meaning, and when I say pneumatic, I mean you can't inflate any air into it. So think of a tourniquet, or like you said, Zora, you bought them off Amazon and you pulled your arm off, kind of thing like that. So think of nothing measurable for the most part. So I like to call those like non-pneumatic bands. They could be rigid like a belt, or they could be elastic like a like a tourniquet where you get your blood drawn. Now, the other two categories are the two that I think this is what I'm going to spend more of my time on. I like to call them like rigid pneumatic categories and elastic pneumatic categories. And ultimately what I'm talking about here is the materials of the band or the cuff itself. And why does this matter? It matters because you are manipulating blood flow patterns. Even though BFR is the end goal, with no matter what on these two categories here, you're going to get a great metabolic overload. You're going to get really good cell swelling, that neural growth hormone response. You can see great results with whatever these devices sit in these two camps over here, okay? So I do need to put that caveat out there. However, when done safely and effectively, I'm just going to really emphasize that. However, these two categories over here manipulate blood flow patterns differently. Now, again, even though the end goal is the same, you're going to actually manipulate blood flow patterns just slightly different. So when we talk about this non-pneumatic category over here, like a belt or something like that, I always had, like you were saying, the gym bros. I had other people say, hey, I got a really good pump in and I got that or whatever. And I said, that's great if you want to use it on yourself. When I'm talking about using it safely, effectively for yourself or as a practitioner to apply it to your clients, it's really hard to reproduce, right? They always say use a 7 out of 10 tightness scale. That's very subjective. We don't know how much pressure you're putting on your peripheral vessels, your peripheral nerves. Think that could cause a little bit of pain, skin irritation. So things like that. I'm like, as a practitioner, don't really tell any sort of practitioners, hey, go buy something that you're just going to tourniquet yourself off. Now, if they want to go do that themselves because they feel like they know how to do it safely and effectively to get their pump in, then I'm like, teach their own is what I usually say. Now with these other two here, when I talk about like a rigid pneumatic category, I'm pretty much talking about a material that has no give to it. So rigid. So think blood pressure cuff. And what is the point of a blood pressure cuff material? It's not a blood pressure cuff, but I'm saying like, what is a blood pressure cuff's point? It's when you pump up the blood pressure cuff, the point of the blood pressure cuff is to cut off your blood supply, right? So then when you turn the dial and you're listening into your stethoscope, you can hear the blood come in and you read systolic pressure and then you hear it trickle off and you read diastolic pressure, right? So the point of a blood pressure cuff is just that, is to cut off arterial flow so then you can listen to when it comes back into the artery, okay? So in a rigid pneumatic BFR system, we use what's called terminology, it's called limb occlusion pressure or arterial occlusion pressure. And you might see that a lot out there in the literature or in like different protocols or things like that, or different devices that'll say that. So what limb occlusion pressure is the pressure applied to the limb to cut off blood supply to that limb. So for example, if you have a BFR cuff on that's rigid, and so meaning no give, and you pump up, whether it's an automatic pump and it reads it itself, or you're pumping it up manually, whatever that pressure is to shut off your brachial artery. Let's just say we're using our upper limb here. You might have a pressure of 160 millimeters of mercury that knocks off that artery, okay? So that means that's 100% LOP, meaning there's no blood going in or out of the limb. From there, you're going to take a percentage of that per individual and exercise there, because remember, we want to restrict blood flow. We don't want to totally occlude for long periods of time. So for example, if you had an upper extremity LOP is what we call it, of 160 millimeters of mercury, and you would typically want to start for upper extremities, take 40 to 50% of that. So then I would set the BFR device to then exercise them at about 70 to 80 millimeters of mercury. So that means we're allowing now some arterial blood flow into the muscle bellies, and we're still restricting venous outflow, right? So we don't want to have that. So anything that's called rigid, and if you see anything out there that's like you got to find 100% LOP and then back off a percentage, you just know that you're now working with a more like a little bit stiffer material, but you just have to do it where you find that number and you back off a certain percentage. So that's kind of how we allow blood flow in still. Yeah.
So that's probably what I was using when I had the blood pressure cuff pump, and I was getting guidance from Chris, and he was saying, oh, he was measuring my arms, because I don't think he was, there must be some formula, because I wouldn't pump it up until I'm like, okay, no, I don't feel anything. Like, that's done. I'm turning blue and I'm going to lose my limb. There must be some kind of formula that these devices are having so that you can figure out what is 100% for me without going to 100%. Do you see what I mean?
Yeah, so there's a few different ways manually you can do it. So if you were to just have a manual pump like that, you could actually just take your radial pulse and find when it disappears. So if you were to take your radial pulse and when that goes away, read what that number is on the dial, and that would be your estimated limb occlusion pressure. Another way you could do it is if you can just go grab them at CVS, get a pulse oximeter and put it right on your finger. And when those readings go away, read what the pressure is on the dial. That's your estimated limb occlusion pressure. And the third way that practitioners could use is using a Doppler, but individual users aren't going to use like a Doppler like on their own artery and stuff like that. But those are two quick ways, is if you can find your radial pulse and someone's slowly pumping it up, you can find your estimated LOP when it disappears. Again, you want to go very slow with it. You don't want to go too quick because you'll probably cut it off before your radial pulse stops. So you'd want to go slow. That's a really good way to estimate it yourself without maybe, say, a device that has a built-in Doppler to read the shutoff, okay? The other way, again, would be is just to go get a pulse ox and just slowly inflate and see when it cuts off. And then you're like, okay, that's my estimated LOP. I'll back off to about 40 to 50% of that, and I'm going to exercise I'll set my bands at 40%, 40 mLs or 80 millimeters of mercury, excuse me. So that's one way you can do that in almost a quick sense, so to speak. There's other devices that are out there that already, you put them on, you plug them in, you press the button, and there's a Doppler in there that reads the exact pressure of when it shuts off. Okay, so then you can also press, I want low, medium, high, or a percentage of it, or as long as it gives you that number, then you can just inflate to 40 to 50% of that on your upper extremities. Lower extremities, you're looking at 60 to 80% of what's called your LOP. When it cuts off your femoral artery, you just go a little bit higher pressures.
People I talk to, including myself, we think, oh, the bands it just doesn't seem I can go so high with the arms. We're always able to do a little bit more with our legs. I guess because they're bigger or thicker, or I'm not sure.
So we're bigger, we have more muscle mass, more fat tissue, and our femoral artery runs deeper. So we need to add more pressure to get to it to shut off. So it's just a little bit more so than up here. And think of when you have less kind of tissues and mass up here, your artery is a little bit more exposed comparatively to your femoral artery. So you're going to use a little bit less pressure comparatively to your legs. So that would be that kind of device category. So you're finding that number that would cut off arterial flow, which means flow coming into the muscle. And then you would take a percentage of that and exercise from there. Now, the last category, go ahead.
Sorry, just as different. So just to explain a little bit, recap. So we have the Amazon bands, which, okay, you can't measure it whatsoever. Then we have the Origin Pneumatic, and we have two options I'm hearing. So you can manually figure out your LOP or your maximum and what you should be training at. And some of these devices have built-in automatically can read this for you. So I'm guessing the ones that have that automatically they'll be a higher price point, but maybe there's more convenience. Then now we're going to go into the elastic pneumatic bands. What are those?
Yep, I'm going to have one here so I can show you. It's got some give to it. And I actually brought a blood pressure cuff here just in case anyone's watching and wants to see it, where it's like there's like stiff material, there's no give to it. These categories over here on the elastic pneumatic means it has some elasticity to it. Just means that elastic pneumatic is a little bit elasticity to it. So it tends to bend and flex with your motion. So what this does is that the elastic pneumatic category is it does not shut off arterial blood flow at all. It allows arterial blood flow in, but it manipulates the venous outflow. We're still restricting, but we're doing so from a venous standpoint. So based off of the elasticity of, there's two brands that are, as of I know right now, I'm not saying that, excuse me, there's not going to be more coming out, but right now that actually allow this arterial blood flow in, but manipulates venous outflow. So here, limb occlusion pressure isn't necessary to find because you actually can't shut off your arterial flow. So I could actually pump you up to probably 500 millimeters of mercury, and I'm still going to be able to find a radial pulse, a faint radial pulse. However, we're drastically restricting venous outflow. And it's just due to the nature and the elasticity of the bands and the way they're like flexing, extending with the limbs, the way the band is set up. It's not actually shutting off your artery. So meaning the other kind of rigid devices are, you want to think about the pressure being added into, say, the blood pressure cuff is going to be direct pressure onto the limb and onto your artery system, whereas the elastic pneumatic system is almost like an indirect pressure, if that makes sense. Kind of how I think about it. So
let me try to understand, because I understood that the rigid and the elastic pneumatic bands, they don't completely occlude. They both have they're both manipulating the blood flow. Is that correct?
Yep, but the rigid pneumatic has the ability to shut off your blood flow.
Oh, because it has the ability, but if you program it not to, it will be similar to elastic or not?
So back to like just the rigid. So if you go to 100% where you're shutting off that artery, you're going to back off, let's just say 40 to 50%. So you're allowing some blood flow in.
Yeah.
But the difference is, so let's just say it's on your bicep, right? And I have plenty of video demonstrations of this and everything. So if someone really wants to dive in and kind of really see what's going on with the dial and everything else so let's just say when I flex and do a bicep curl, the pressure that's into the rigid band is adding already pressure that I'm developing now in my muscle. So if I develop a pressure in my muscle, it's adding to the pressure already put in. So probably on the concentric motion or the motion that where you're like really contracting that muscle, you're probably going to see a dial or the pressure go high. So you'll probably like go over your LOP and then go back, LOP back, but you're still manipulating like arterial flow coming in and out. But again, we're not shutting it off completely. Does that make sense?
Yeah.
So we're still allowing arterial blood flow in and manipulating venous blood flow out, but every time I flex, that pressure that's in my muscle belly is going to add to the pressure that I put into on this rigid system. But again, does that make a huge deal? No, because you're still exercising at that 40 to 50%. So every time you're exercising, you're opening and shutting that artery for the most part. And then there's Go ahead.
Sorry. So then the elastic ones, I'm trying to visualize. Yeah. So every time you do the bicep curl, it's adding, but since it has some give to it, you're adding less. It's less intense or less, I guess, pressure, a little bit less pressure than if it were a rigid one. Is that correct?
Yeah, so the pressure could be, but I could put the pressure in here upwards to 400 millimeters of mercury, which is very high.
Yeah.
So, however, the pressure in the band is high, but due to that elasticity, it tends to flex and extend with the limb more. So it's actually not going to shut off the artery. However, we're going to create that distension and venous pooling where we're restricting. It is compressing on the venous system, though. So where we are compressing, where we're starting to see that venous distension and blood pooling, cell swelling, that metabolic overload. So we're still manipulating blood flow patterns, inducing metabolic overload, cell swelling with both of these types of devices. So you're doing it's just differently, if that makes sense, where one, we're manipulating arterial flow and venous flow, where the other one, we're really manipulating venous outflow.
Got it. Okay, I got it. And if you didn't get it, stop and rewind and listen to it again. It makes sense to me now. So then why would somebody want the elastic or the rigid, one or the other? And my guess right now, because I do have both, the
Mhm.
rigid one is a little less comfortable. The elastic one, I seem to be able to do it, but I'm also want you to cover some of these devices do a cyclical mode where they
Yep.
inflate for 30 seconds, deflate for 5, which is like right when it gets intense, you're like, woo, it's done. And then there's the rigid. And after, for me, it's like 10 minutes. I'm like, okay, I got to get these things off my arms. They're uncomfortable. Is that the difference or are there more differences?
Yeah, so when you want to get into the nitty gritty of this, if anyone listens to who's like a device company might want to have a great conversation with me afterwards. But is so what happens here is I like to, because then again, I'll go through this whole education and practitioners are like, great. So what do we do? That's why in my either my in-person courses or education I give, I have every device that's pretty much out on the market. So I let them play with it, practice with it. What do you think is beneficial? And like we go through this whole decision tree as practitioners on what's best. So from a user standpoint, I would always like to say is cost is going to potentially play a role, right? So cost it might always play a role. But the other thing I like to say about cost is start to think about even if one device that you're like, oh, I really want that, it's a little pricey. Think about all the other benefits that you don't have to purchase then. You don't have to purchase the heavy weights. You don't have to go to a gym membership. You can do this all at home. You can throw them in your bag. You can travel with them. You don't need all this. So even though there might be a slight investment up front, think about all of these other benefits and ultimately potential other savings that you might have down the line. That's one thing I always tell people is just frame your mind in that sense. And there are some companies out there that are actually taking, I believe, FSA and HSA, and I think more of them out there are taking that, like the health savings accounts and flexible savings accounts, which I think is great.
That means for people who don't know what that is, that you can get reimbursed for the cost of what you've paid for these devices.
Correct. So then the other thing would be is when I like to start someone with BFR is it's, as we know, Zora, sometimes it might be hard to get people to exercise anyway in life in general. It's like taking that step of, ooh, I got to do something about my health, right? Now, if I put something on that's extremely uncomfortable for them, they might not want to use it. So comfort's going to play a huge role in this. It's hard for me because there's people who like the bands and the cuffs in each category. So it's hard for me to explain, oh, this or that. I wish I could just say, hey, just go do this one. However, there is more of a trend on comfort level. So sometimes the elastic ones tend to be more comfortable for individuals, not always, but sometimes a little bit because it tends to flex and extend. You can also increase your millimeters of mercury up to 400, 500, which is a very high pressure in the band. So you're drastically manipulating venous outflow, but you're not cutting off arterial inflow. And sometimes when someone maybe puts the pressure too high on a, let's say, a rigid device, they're actually continuously cutting off arterial flow. That's where you're going to get that maybe hand tingling, that hand numbness, and that arm numbness feeling, which you don't want with BFR. We don't want your arm to go numb. We don't want your hand to go purple, things like that. So if you're using something where you could potentially be continuously shutting off your artery, that might be a decision you might want to take into consideration, is what, I'm saying there. So when you're talking about like the pressure's on, pressure's off, if we stay in the rigid pneumatic camp for a little bit, there are devices out there that do what I'm trying to say. So let's just say you find your LOP and you take 40 to 50% of it, and you can program into the machine. And as long as you're hooked up to the tube or whatever it may be, it tries to increase and decrease the pressure with your exercise to try to keep you within that 40 to 50% range. So it's more comfortable. That's one way. And there's some devices that try to do that. And then there are other devices, so to speak. And then you could increase the pressure, decrease the pressure. One of the systems I believe you were talking about is correct me if I'm wrong, I believe you're talking about the KAATSU system with the gradually increasing pressure, the cycles. Yeah. So that system takes what you could actually do constant mode, where I say plug in, put up to a certain pressure, unplug, and I can go exercise to get that big cell swelling, metabolic overload. Really great for muscle building, really great for rehab, things like that. They also have what's called the cycle mode, where it's gradually increasing the pressure on the limb for 30 seconds, that it has a nice 5-second release, gradually increases the pressure into the band, 5-second release. So what that does is when you're like, okay, what are the cycles doing? The cycles are actually really warming up that vascular tissue by altering the amount of pressure coming on and release. We're really warming up that vascular tissue and increasing what's called that nitric oxide release, which really helps then enhance the blood flow. And so when it does that, it's really increasing blood flow to the area. So cycles are really beneficial to blood flow to the area. Now, the other benefit to the cycles would be from a practical standpoint is it really gets someone used to BFR because we're adding pressures, then we get a nice release. We're adding pressures, then we get a nice release. It's a really nice, eased way into the modality. So that system has multiple modes ultimately. So you could do what's called the cycles, and you can still exercise while doing the cycles as well. You can still go for walks, do your bicep curls, do your squats while the system is gradually increasing and releasing. You can still do your exercise regimen, or you could use the constant mode where you place X amount of pressure into the band and you're really manipulating venous outflow at that point. You get that metabolic overload. That's where you're feeling like, ooh, after 10 minutes, I'm tired. I'm really, really gassed. I'm really tired. And you're inducing that cell swelling. So yeah, there's systems out there that kind of have these cycles where it could be a huge benefit for that vascular tissue as well. It'll still have that neurohormonal cascade cell swelling response. It'll still have it with the cycles, but it'll also have it with constant mode. So again, then we could get into the nitty gritty of the tech, the this, the that. What are you looking for? Are you looking for Bluetooth? Are you looking for it to be tethered or untethered? Things like that. I would say too, for someone who's like, okay, with all this conversation, what the heck? I just want someone to tell me what to do. You know what I'm saying? You want to find a system that's really easy to use. If you have to spend 15 minutes figuring out programming for it or finding an LOP or something like that, in my experience, people then put the bands off to the sides. I don't have that kind of time. I only have 15 to 20 minutes to myself. I would like to be able to apply something extremely quickly, get my workout in 10, 15 minutes and be on my way. You know what I'm saying? So ease of use, cost, comfort, all of that's going to play a role in, I think, what you should decide on. And like after this, you can even tell your listeners and so forth, I'm more than happy to take a deeper conversation with anyone who wants to get in contact with me or is like, hey, I'm making this big decision on XYZ. What do you think might be beneficial?
That would be very useful. Yeah, I will have your links in the show notes because I know people do like just to have consultation with people who've used various types of bands. So thank you for offering that.
Of course. And so typically with my physical therapist too, they actually might have two devices. A lot of the clinics will have a rigid pneumatic device where it's very stationary. You're using LOP, you're backing off a percentage and you're keeping it in those narrow limits. And then sometimes from their other patients, they're like, you know what, this will be great to pump up and I can go have them do more of their exercises where there's a little bit more agility or a little bit more this and a little bit more freedom. So we're also trying to see it's not one or the other. So we're seeing like, hey, it might be good to have a couple of devices in your arsenal if you're a practitioner, so to speak. You might not want to, as you, the user, you might be like, I want one really good device to use for my husband and I or myself. And that's a whole other thing too. But again, there's multiple tools you could have in your toolbox with BFR, that's for sure.
Yeah. And I imagine if you are a physiotherapist or working with clients, you don't want to fuss around for 10 minutes trying to get stuff on or plugged in, plugged off and measured. And like, that's a whole part. I didn't even think about that. But yeah, if this is your business, you can't waste time. So you probably want something that's fast. And of course, the ease, cost, and comfort are the things that'll help people decide. I'm wondering in your experience, if you have any research or understanding of this, when I use the KAATSU bands, that's cyclical, they're comfortable. I'm like cooking, I'm just walking. I'm not even really doing anything sometimes. And I have them on that I almost forget them on. They're like 45 minutes on my arms. I could do 45 minutes on my legs. I've been doing this for years. I gradually built up. So people don't do that if you have KAATSU. But when I use the rigid ones, honestly, it's like 10 minutes and I'm like, gotta get these off. And I still have the gains. Like, I don't know if it's because it's constant, and KAATSU has the constant mode too. I have never experimented with that, I should, is if I do constant, can I just do it in a short amount of time to get equal amount of benefits as if I were doing it for 45 minutes or an hour of a cyclical mode, let's say?
Yeah, that's definitely probably a great question for KAATSU's research specifically on cycle modes. But I would say, so the reason you're feeling so tired with constant mode is that, let's just use it from a rigid standpoint. If you're manipulating arterial inflow coming in, you're drastically decreasing the amount of oxygen that's already coming to the muscle bellies. So you're already having to activate your bigger muscle fibers in order for yourself to keep exercising. When you activate your bigger muscle fibers, like your type 2Bs or type 2Xs, they only use anaerobic metabolism. So when they use anaerobic metabolism, you're building up lactate and hydrogen very quick. That's why you fatigue extremely quickly. So from that standpoint, where you're like at 10 minutes and afterwards, it's really ultimately comes down to energy systems and the amount of nutrients you are manipulating in and out. So that's why, for the most part, you are getting exhausted sooner, is because you're manipulating arterial inflow, oxygen. So we're recruiting those type 2B muscle fibers. You're ultimately recruiting your entire muscle belly. So when you do that, we're going through what's called anaerobic metabolism, meaning without oxygen, which we produce a lot of waste very quickly. But since we're also restricting waste clearance, venous outflow, that lactate and hydrogen are drastically building up really quick. So you feel that metabolic burn much quicker. So you're feeling that kind of that overload. It's really all comes down to what you're manipulating and what muscle fibers you're activating. The reason you also might be able to exercise with cycles a little bit longer is because of that gradual release. So even though we're still manipulating venous outflow, you are actually still having a nice 5-second release where some of that blood can get flushed out. Mm-hmm. So it's not building up as quickly as if you were in constant mode. Does that make sense?
Yeah, that makes sense. One thing I'm wondering, when people ask me about getting some bands for their parents who are older, that's their 70s, 80s, I tend to lean towards recommending the cyclical mode. And in my head, I'm like, oh, it's more gentle. I know it's doing something. It's so deceptive because you feel like, oh, is this really doing anything? And it is. Mm-hmm. So I'm wondering if that's correct, if I'm doing the right thing, or just maybe all these devices could be fine for an 80-year-old, but I just seem to lean on the cyclical one just because I feel it's more gentle.
I would agree with you on that, especially with the aging population. And don't forget, like, sometimes, again, the comfort level and pain tolerance. And the more you're manipulating arterial inflow, the more you're going to actually get a little bit more uncomfortable feeling sometimes with that rigid kind of direct pressure onto the limb. If they have any sort of skin breakdown or they're weaker, any sort of additional pressure onto that might be just more uncomfortable. They're not going to, in my experience, want to do it. I've tried multiple devices out, and I can pinpoint and tell you with my aging population, they're like, if I'm going to do this, one's way more comfortable for me. I like this one. It's pretty standard. I'm not saying I don't have aging individuals with certain other devices. I've worked with athletes that came from PT and said, hey, they had this device. Do you have it? Can we continue to work with this? I'm like, sure, let's go for it. If I think it's reputable, I know how to use it. Plus, if I have them all, I'm like, we can do whatever one you want. But when I'm helping someone decide, again, we want someone to keep using BFR. We want someone to do this to get all these great benefits that we're talking about today with musculoskeletal health, cardiovascular health, cerebral blood flow, collagen development, all of these other things. You're not going to get someone to do that if they're uncomfortable. If it's uncomfortable or painful in any sense, they're not going to do it, and they're going to miss out on all these great benefits. So I always tell practitioners, anyone starting off, you always want to ease into the BFR modality. Start lower, start slower, even with cycles, or start with even lower pressures to start with. And you would always want someone to come back to you and say, hey, let's up the pressure, or let's up my exercise regimen. I didn't feel enough of a good pump. I would rather that because I can get them there quick. However, if I start too fast or too hard, I'm risking them being like, nope, don't do that to me ever again, kind of thing. So I would take that into it's definitely comfort, reproducibility, ease of use, all of that is going to really play a role. But to anyone who's listening, who's like aging, wants to build muscle, increase balance, functional capabilities, comfort and reproducibility is going to be a huge factor for this.
Yeah, if anybody's also has the rigid bands, then ease up. If you're not using them because they hurt, we'll go lower pressure and
correct.
You build up. I mean, I've seen it myself and with people who've used these that, okay, we'll go a little bit lower, and over the weeks and sometimes months, then you will see that your body adapts, and it does, and then you can get the more pressure. But I'm wondering if there's an older adult who has heart disease or cardiovascular issues, high blood pressure, on medication. is it safe for them to use this? Because it's so many benefits. They're almost like,
Mhm.
but I know they should probably obviously talk to their doctor, but when they do, the doctors don't know what this is. So how do you guide
Yeah.
people who want these benefits, but they already have issues?
Yeah, you talked about you hit the nail on the head of how this is difficult because you have to send them. If someone came to you and said, hey, I have peripheral artery disease or I had XYZ, yeah, I need to get them cleared by their physician to be able to do it safely and effectively. There's a lot of really good research on cardiovascular variables with BFR. Again, you would probably want it to work with a practitioner on this aspect or work in conjunction with a trainer who's trained to train you at home to get you started, so to speak. The only thing, there's some absolute contraindications out there, which are like a current DVT,
What?
or which is a deep vein thrombosis, which is a
Oh,
clot in the leg. So like a clot in your calf. Like if it's current, you're causing vein distension anyway, and things like that. It might cause like pain, stuff like that. Now there's other things called like relative contraindications, meaning check with your physician. So would mean, did you have a past cardiac event? Did you have a previous stroke? Things. It doesn't mean you can't use BFR safely and effectively. It just means let's get medical clearance. But to your point, Zora, it's a lot of physicians don't know about BFR. So the concern there is to say, they'll just be like, since I don't know much about it, avoid. And then that's where we're at. We're at a sticky point right there with that, so to speak. And that's why we're doing our best to educate physicians and doctors on the benefits and what's occurring there. So when someone says blood flow restriction, oh, could that potentially increase risks of clots? And there's a great study out there that shows no, there's really no increase in risk. It's like a meta-analysis of like DVTs, things like that. And also what ends up happening is very similar to after high intensity resistance exercise, it's been shown with BFR as well, is we have a really acute blast of what's called TPA antigen, which actually decreases the formation of clots. So with exercise, that's why we want to exercise, right? So all these great things happen with exercise. So we see it with BFR, but we also see it with high intensity exercise, that you see this quick burst after the exercise of the release of this, which actually helps decrease the formation of clots. So when you're talking to someone, oh, could it cause this? It's like, actually, no, it's when done safely and effectively, extremely safe to use. The only other thing I would say is they said, or there's what's out there for absolute contraindications are, say, uncontrolled hypertension. So that means you're not on any medication for hypertension. And a lot of people don't know that they might have hypertension. So there's some great studies out there that shows BFR, KAATSU, and so forth help lower resting heart rate and lower blood pressure with individuals with hypertension, but they're on medication. For example, if you were to get a patient or a client, or you didn't know yourself if you had high blood pressure, check your blood pressure, see, and if it's consistently high, like I'm talking like 150, 160 over 100 or over this or that, like consistently, you're going to need to go to your physician first, get that hypertension in control, and then you could safely and effectively start BFR, which then BFR can augment the further lowering of your blood pressure. And then maybe, just maybe, I'm just saying, you could potentially lower your dose or get off the medication completely. And that would be our hope, right? Is to less medications. That would be another absolute contraindication. Right now, pregnancy, there's just not enough information out there. It's kind of using it postpartum, and I've used it postpartum. I've had 3 kids in the last 4 years. So where I use BFR is a lot postpartum recently. And the only other thing too would be, so when you might read, okay, over a wound or vascular access or surgical site, they're really talking about the affected limb there. So again, when you had, let's say I have a wound on my right leg, but my left leg is fine or my arms are fine, we could still get this big neural hormonal response. So when they say, oh, this is an absolute contraindication, they're talking about the injured limb. I just want to remind people of that there's other benefits you can do systemically to maybe help heal that area.
this is such good information. I'm so excited that we've covered so much. And so we're going to wrap up here. But before I let you go, I know you're a busy mom and you've got 3 kids and a really demanding career. So how do you personally integrate movement and recovery practices like BFR into your own life to stay strong and resilient and balanced?
Absolutely. It's funny. I'm just thinking of a conversation I just had with my husband and I the other day. We looked at each other amidst the chaos. I have an almost 4-year-old, almost 20-month-old, and an almost 6-month-old. So we have three kids under 4 right now, which is, it's amazing. Don't get me wrong, but there was some sort of chaos going over at nighttime in the evening, like usual. And I think we just stopped and looked at each other. I don't even know if we've had a full conversation. I don't even remember the last time we did. And my husband looked at me and goes, what did we do before kids? I'm really trying to think. He goes, what was our life before? He goes, did we just exercise for 2 hours? Did we go for walks? Did we go to dinner? So we were just laughing at the level of just time that we have. I'm very lucky and blessed to have a very nice flexible schedule to be with my family and the kids at the college and with what I do, because family is number one for me and always will be. But we're busy. We're very busy. We're busy parents. We have careers. We have our kids. We want to spend time with the kids. So where I like to do it, and BFR is great. So if you're out there, whether you have little kids or don't, or just have a very busy, hectic life, or just not enough time. Time is always the thing. I don't have time to exercise. I don't have time. If you can find 20 minutes per day or 20 minutes a few times a week to use BFR, you're going to get some amazing results. You can get a lot of results in a short period of time. So my husband and I use BFR all the time for our own musculoskeletal health, plus our cardiovascular health. I'll go down here on the treadmill for 15 minutes, putting BFR on my legs and getting both musculoskeletal and cardiovascular system moving. He uses it a lot for 15 minutes. He does it a lot more so for muscle building and hypertrophy and strength gains and things like that. But we don't have an hour every day to do a full lift. We just don't anymore. So we also
lifting babies so you can have them
on. Babies. I put one of them on my pouch as my big weighted front here and was doing squats with him the other day. So you got to be creative, right? So the best part about BFR is it's very versatile. We'll walk the kids, we'll walk the dogs with them, we'll bring them in our suitcase. We'll walk on the beach with them. You can do yoga on the beach. You can do body squats, exercises. They're very versatile. So we have been very creative with our exercise regimen. We're always on the move. So no matter what, I make sure I get at least anywhere between 10 and 15,000 steps a day, which isn't hard with kids and everything else and stuff like that. But I'll apply the bands on, doing exercises. And even if I have a couple clients training, I'll train with them at the same time. So you find your ways to just melt it right in. But it's definitely been great postpartum, because postpartum, I haven't, for the last 3 times, right away, you can't lift heavy weight. And I was recovering, depending on how your recovery went. I had a couple of recoveries where I actually couldn't lift for a longer period of time, like heavier weights, and it was killing me because I'm an active person. I like to do weights, but I was able to start with gentle BFR, with walking and like lifting low weights and not putting as much stress on my tissues. And I really noticed a difference with my muscular endurance coming back, my muscular strength coming back, plus just feeling that overall sense of, that, I guess, that euphoric feeling with exercise again. So it really has helped me with postpartum recovery. And it's now I use a mix of BFR and heavier lifting now that I'm about 5.5 months postpartum from my last, that I'll use a mix of both. So yeah, it all depends. And so we put priority in our family. We always say what we invest in is our health and our experiences for the kids, travel and things like that. But health is number one. So they'll be down here. Like my 4-year-old was pretending to bench with me the other day. He was counting my reps. So we involve them all the time with it. So hopefully that'll just become a habit for them as well. So that's how we fold it in.
Oh, I love hearing that. It's so practical. I have to say, because I couldn't move very much, I just was wearing them while I cooked, while I was cleaning the floors or something, whatever I could put the bands on, and I didn't have to make time for exercise in the sense that I just honestly couldn't. So you don't have to carve this time out. I should be wearing them right now. I'm feeling guilty. I'm not even like I'm standing here with
I know, we should have.
Yeah, we could have had them on during this whole interview and then it would have been done. So really, I like to tell people to just integrate it into your everyday life. If you can use them while you're going to the gym, great. If you can't, just use them. Don't let them sit in a corner. And I also lay them around all over the house like toys. Like I don't have little kids in my house anymore. So you probably have all these toys everywhere, but I think if I trip over them, that reminds me, put them on. Yep. Of course, got to get them on. So if you got them, use them. They're very practical. And I agree with you 100%. I put them in my suitcase. I'm a recovering nomad, so I was carrying them wherever I go. And I still travel a lot. They're always going in my suitcase. They're not that, they don't take a lot of space and they're not heavy. And when you're traveling, you don't know if you're going to get to a gym or not to a gym. And in your room, you can get very creative YouTube videos. If anybody's following me, you know what I'm talking about. I put this all in stories. But Before I let you go, I would love people to know more about your programs because I know you have an online comprehensive course in blood flow restriction training, and you're giving us also a PDF on all the different devices and all that. So tell us a little bit more about what you have to offer for anyone who's listening.
Yeah, absolutely. I think we had talked about it a little bit a while ago is that I had found a gap out there. I got my PhD in exercise physiology, specialized in blood flow restriction training and muscle physiology, biochem physiology. So I was like, kind of really spurred me to go. And I went through all these like device education things and so forth. I'm like, wow, there's really not like a practitioner, like a really big comprehensive aspect to practitioner courses out there where it's this unbiased look at just really taking a deeper dive into the physiology. So we do go over the history of where it comes from. Then I segue into talking about basic muscular and cardiovascular physiology. Then we head into BFR and relate it and how it's similar and different. We use all the different devices out there. So I have two versions of my course. Right now it's live. I have like ones where you could book us and we come to you, or you could come to me. But for the most part, I've flown everywhere to go give the course to clinics, to practitioners, and so forth. And so you get to take a deep dive, get your hands on all the different types of equipment, go through what we went through and say, okay, well, then by the end, they're like, okay, hey, this might be really good for our clinic, or I might use this for personal use, but this for my clinic. And then we go through the practical applications. We go through safety, clinician, practitioner tips and tricks, and even like self-user tips and tricks. Finally put it up online. It's about almost close to 12 hours of content online. It's a really deep dive into, it's really meant for get CEUs for physical therapists, athletic trainers. People can submit it in for personal trainers. I've gotten CEUs for it. So it's really for kind of strength coaches, personal trainers, physical therapists, athletic trainers, occupational therapists, especially for those who really want to not only use it for themselves, but they might apply it in practice to their others and say, hey, I could get some more clients with using BFR. Hey, a lot of my competitors aren't using BFR. Boom, I'm going to use this as a tool in my toolbox. That would be a great way, a great addition to your training toolbox. So it's really for the practitioner, this masterclass. However, I have individuals who just want to use it and love science too and want to take a deeper dive in because they're like, hey, I'm going to use it myself, but I'm going to just go ahead and take your course because I love taking it. We've had people do that as well. So it's not just for practitioners. It's people who are like, I just know I take a deeper dive on the devices and go through all the different ones and how to measure and all these kind of things. But a lot of people like that.
That's people like me. Yeah, definitely. I've got to go check that out because.
And that's kind of I kind of take that, like we said, that unbiased look. We look at everything that's out there, the different materials, how it affects blood flow patterns, and we just go from there. And then we just open it up and we give a bunch of resources and all those kind of things on getting started with BFR, safety, all those kind of things. So it's this like big master class we have created, and there's an online and an in-person format. I know my next project is going to be for the individual user. So say, for example, someone's like, I just want a 2-hour quick overview of the benefits, how to put them on, what are some safety, take me through some exercises. That's my next project over this next year. So stay tuned for that. Because there are people so people just want to, I really just want a really good look at how to use this. So that's actually on my agenda, which will probably be just a much shorter version of this, but for the user. So for someone who's listening might be like, oh, I want to actually just really know how to use it safely and effectively. What are some really good exercises to do with it? So that'll be coming down the pipeline, but
would be very good to know. And as well, maybe if that for that just user, it would be interesting as well to walk through a couple of devices, even if it's just this three, one is a non-pneumatic, one's a rigid, one's an elastic, and just help people as well, guide them in choosing one as well. It's something very short. I don't know. That's just my 2 cents, but I think it's a great idea.
Absolutely.
I'd be all over that. So everyone can find more about you at glasstrainingand education.com. And I'll have a link to that in the show notes. You're also on Instagram and YouTube. Is there anywhere else that we should direct the audience or what they should, any last words before we let you go?
Nope. First and foremost, I want to thank you, Zora, for having me. This was a great conversation. As you could probably tell, I could talk all day with you on this. So this is super fun. And I hope during this conversation today, anyone listening hopefully our conversation has eased their mind a little bit on BFR and using it, and maybe are a little excited to either pick their bands up if they haven't used them for a while, or go ahead and get some themselves and maybe start on their own BFR journey. But if you still have questions, feel free to reach out to me through glass training and education at gmail.com, or through Instagram is just at Dr. Susie Lachowski. I'm sure Zora will have that information for you. I'm always happy to answer questions for you. And I just hope that we can ease your mind in starting this so you can get all these great benefits. I just want to thank you for having me.
Oh, thank you. And you're just done a huge service for everybody and having an unbiased opinion and an understanding of all the devices out there. This is exactly what we needed. Thank you, everyone who's listened to the end of the show here. Thank you for your time. We really appreciate it. And thank you, Susie, for your time. And I look forward to seeing you again.